File this one under Don't Doubt Me. Our healthcare black hole. And again, nobody in Washington right now wants to do a damn thing about it. You know, it's interesting, too. They could. They could. You talk about Medicaid right now. Do you understand that 81% of Americans support requiring able-bodied adults to work in order to keep Medicaid benefits? And you have Republicans pushing back. 81%, which basically tells me that they're getting paid or they benefit from this some way, somehow. Again, 81% of Americans. That should be bipartisan. Let's get these things done. They won't do it. In the same sense, go back in time, everybody blames John McCain. John McCain gave the thumbs down on repeal Obamacare. Well, again, we told you at that point in time was repeal and replace. Republicans didn't have anything. They had nothing. Again, they're not well prepared like Democrats. I mean, Democrats were ready to go as soon as Obama got in. They were ready to go with Obamacare, had it. Republicans didn't have anything. Not to mention the fact they didn't want to do anything. And John McCain basically volunteered. He did. He volunteered. He said, Trump and I, we don't like each other very much. Everybody knows that. I'll scuttle the whole thing. I don't have any problem doing it. And he did. But if it wasn't him, it would have been somebody else. Again, what you need to know is that both Republicans and Democrats love their entitlements. Love their entitlements. They like, Trump wants to create another one with the baby checks that he wants to hand out. Anyway, everything that we told you about Obamacare and what was going to happen has come to pass. The annual cost right now of insuring a family in the United States is $35,000. $35,000. And again, small business owner. And I pay over $35,000 for my family of five. And that's, everybody's got a $5,000 deductible on top of that too. Yeah. Going back to my coverage of Obamacare and the calls that I made on this, I called it at the time. I said, we're going to experience, starting to experience in 2013 with when I wrote this, one of the most destructive pieces of legislation in history, which was Obamacare, the Patient Protection Affordable Care Act. Started out at 2,700 pages. 99% of lawmakers failed to read. It's the time. So I don't even know how big it is now. So the time was, in a couple of years, got over 20,000 pages. And that's, remember when Pelosi said we have to pass the bill to find out what's in it. Payouts and premiums. And again, I'm going back to 2013. We're going through the roof. Now, like I said, $35,000 per family. Remember when Barack Obama told you that your health premiums were going to go down by $2,000? The same exact healthcare plan that I pay over $35,000 for today prior to Obamacare, which was high deductible health insurance coupled with the health savings account, cost me around $5,000. Around $5,000 at the time. Again, the thing is, it's been an absolute disaster. Again, and some of the other calls that I made on this, again, just sound familiar. You have a difficult time finding a doctor. Doctors taking early retirement. The eroding autonomy was part of the reasons why they're doing that. Decreased pay. And this is 2013. And we all know what's going on today, how much worse it's gotten. I said, what is starting to happen is that many physicians have begun to hold group appointments. Physicians can see up to a dozen patients with similar medical conditions all at once. Again, I have not had a group appointment since I was in high school when we were all told to drop our drawers and cough. Guys, you know what I'm talking about. Again, estimated shortage of 52,000 physicians by 2025. That's where we're at today. McDoctor, again, wrote this 2013. We all should know by now how government loves big big budgets, big laws, big business, and you can add big medical to that list. The big Obamacare laws forcing the local doctor-owned medical practice to be a thing of the past. Not in the not too distant future. This is me, okay? Yep, and I don't even have a crystal ball. Most physicians will be hourly wage earners, likely employed by a hospital chain. So the same model that produces the Johnny on the spot service that you get from your local barista or fast food counter employee is now going to be extrapolated to medicine. Yeah, when doctors working in small office environments, Washington, D.C. bureaucrats have a difficult time regulating them. It's much easier if we round up all the outliers and force them into big hospitals. Obamacare shifts money to favor the delivery of outpatient to hospitals and hospital-owned networks, strangling independent physicians. And Chapter 11 bankruptcies starting in 2013, and we've seen it. And this is what's happening now, and this is what most of us are dealing with now. It's what I do. I actually, I question whether or not I have health insurance. I don't even know why. I just pay. Not too distant future, small but healthy market will arise for cash-only personalized private care for those who can afford it. There will always be competitive, market-driven clinics, hospitals, surgery centers, and other arrangements, including medical tourism, whereby healthy care packages are offered at competitive rates in overseas medical centers. Similar healthy markets already exist in areas such as LASIK eye surgery and cosmetic procedures. The medical profession will survive and even thrive in these small, private niches. In other words, and this is where we're heading to right now, it's going to be a two-tiered system that already exists in many parts of the world. Again, file healthcare under Don't Doubt Me and where we're at today. WatchDog on wallstreet.com.